Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Dr. Stephen Brownstein here, host of the Dynamic Radiologist Podcast, where I feature top leaders in the health field and what they are doing to change the world. Past guests and organizations I've worked with, Rutgers Medical School, Newark Beth Israel Medical Center, and many more. I have Dr. Jeremy Weiss here, who's done thousands of interviews with successful leaders in all fields and health professionals, and we have flipped the script, and today he will be interviewing me.
Dr. Brownstein, thanks for having me. And you know, the age-old question from the medical profession translated to the chiropractic profession is there can be biases. And we were just talking off camera, and we were talking about why do you like chiropractors? And even your wife wonders, why do you like chiropractors? And my wife even wonders, chiropractors are strange. Like, if people don't know, I'm a trained chiropractor, but there is a bias there. So we're going to dive deep into why do you, board certified radiologist of over 40 years, you've seen almost everything under the sun as far as imaging goes, why do you like chiropractors? So this episode, we'll get into that. This episode is brought to you by Dynamic Medical Imaging that you started over 16 years ago. If there's a doctor, doctors from all over New Jersey refer their patients to you, even their family members, to your imaging center. And you could also check out thespinalkinetics.com, where people send you from all over the country their stress radiographs, and you have a special technology called CRMA where you actually measure with advanced measurement and abnormal motion. So people can check that out. So why do you like chiropractors?
Well, luckily at an early age, my cousin's frat brother became a chiropractor.
Okay.
So there was a familiarity there. And then in 1980, I was a radiologist at Union Hospital, and this tall, bald guy comes in, and it was Dr. Litter, and his son was actually an osteopathic resident at the time at Union Hospital. And we slowly became friends to a point where Bill, once my dad died, became basically my adopted dad. And through Bill, I was introduced to Dr. Yoakum and Rowe, Terry Yoakum and Lindsay Rowe, who were were chiropractors and learning to be a chiropractic radiologist. Terry was going back and forth to Australia. And so every time that Terry was in town giving lectures, we'd meet at Bill's house and go to his office, and we throw x-rays up and basically, in a hot seat, so to speak, what's the diagnosis? And then, Terry was going to write a book, and he couldn't find an MD radiologist to write the foreword. So he asked Dr. Litter whether Bill would ask me, and I said, sure. So I was actually assistant chief at the VA in East Orange and head of CT at the time. I wrote the foreword to Terry's first edition, and also 37 of my cases are in Terry's book. Now it's the third edition. I don't think he's 72. I don't think he's writing a fourth edition, unless his daughter, who's also a chiropractic radiologist, decides, Alicia, to do that. But and also when Lindsay Rowe came over, we'd spend time. So the major radiology textbook that every chiropractor uses in the world, I had a part in it, and also it's been used by well over 50 medical schools as well. So it's not just for chiropractors. And both Bill, Dr. Lear, and myself donated our teaching library to Palmer Chiropractic College. And Dr. Mark Chiori, who was a radiologist at the chiropractic radiologist at the time, said, Steve, can I use a couple of your cases? I'm writing a book. I said, sure. So he sends me a copy, and 300 of my cases are in Dennis's book.
Well, just a few.
I said, my name should be on the cover. So now Dr. Mark Chiori is chancellor at Palmer. So I'm probably the only radiologist in the world that's had a major impact on both the major chiropractic radiology textbooks used throughout the world. And I always tell somebody, if I can become friends with a chiropractor in 5 minutes anywhere in the world, as long as he has a bookcase. So, and you asked me why. Besides the education part, I feel they actually help people. And in fact, I have 3 chiropractors, either partners or on staff with me, all went to Palmer College. So whenever my back hurts, I don't have to go too far to get treatment. And I've had my back cracked, and you cringe initially, especially when you crack the neck, but I feel better. And back in 1980, it was almost criminal to be associated with chiropractors. It was before the Wilkes versus the AMA decision for collusion came down, and radiologists could refuse to interpret or do chiropractors' x-rays. And to this day, a funny story, I'm working with the Imaging Center down in South Jersey, and the owner went into the chiropractic's office and saw one of my reports, and he asked her, "Is that Dr. Brownstein the same one that's in Dr. Yoko Monroe?" And Shazine, the owner, said, "I'm not sure, let me check." So she called me up. I said, "Yes." And I could see her face turn red in excitement when she realized she had a celebrity on. But all aside, I enjoy working with chiros. They don't have most of them don't have their head up, up in the cloud. You're down to earth guys, and a lot of doctors are too. But I have a great rapport with them, and to this day.
If there was such thing as a celebrity radiologist, that would be the Yoko Monroe and Mark Urey books, and then you, because you had a hand in it. I think you have on hand the books, and I actually have on my shelf in a different office. But if people are watching the video, if that is the Yoko Monroe's Essential Radiology Volume 2,
edition. Third edition.
Got it.
And this is Dr. Mark Urey's second edition.
Yeah.
So it's pretty neat. I can call Terry up anytime. He tells me about his latest adventure, because I think he still plays baseball at his age.
Really? Okay.
And he's good friends with a lot of the Cardinal players or ex-managers. So I think he would have been a ball player.
Does he live in St. Louis? Where does he live?
No, Terry lives out in Colorado.
Oh, got it.
But he actually wrote a textbook or a book about being a lefty, because he is.
Interesting. So why do you like chiropractors? I think you explained it. And, just talk a little bit about chiropractors. Do you find they tend to do more imaging, less imaging? And I know you have chiropractors who do send you different stress radiographs too, and how that works.
Well, I feel that some do, majority of them do too little, because majority of them don't even do radiographs anymore, and they certainly don't do stress radiographs. And the thing is that if I'm a patient, I go to a chiropractor. He does a physical exam. Me, with my knowledge, I would expect them to do radiographs and stress radiographs and send out for computerized radiographic menstruation analysis, because then he can correlate his clinical findings with the radiographic abnormalities and direct a treatment plan. If then I reach plateau or go downward, then you do an MRI. And then you correlate the MRI findings with the CRMA findings with the physical exam, and maybe you do an EMG. So you have all the clinical and the diagnostics. You put it together to find out what truly is wrong with your patient, and then modify your treatment plan based on all that information.
Yep. What just from your conversations with Terry Yoko, it seems like you know him the best out of the Yoko Monroe or Mark Urey. What things that he say or advice or things in the book that strike you that people should maybe know a little bit more about him and his personality?
Well, I think you had to put it in context. Up until when Terry wrote the book, there was no authoritative radiology textbook that a chiropractor wrote. And he had a hell of a time convincing the publishers. And what's interesting, Donald Resnick, who's a world-renowned bone radiologist, refused to, and a good friend to Terry because Terry trained with him, wouldn't write a foreword because he didn't think it was going to be a success. Now come the second and third edition, oh, it's a success, I'll write the foreword, which he's done. So the other thing, the one thing I forgot to say, based on my influence with the chiropractic radiology community, I was actually nominated to become an honorary fellow American College of Chiropractic Radiology. Probably only a handful of radiologists throughout the world has been so designated, and I nothing for nothing. I feel good about it because I did something significant and helped their profession. So, it's with Terry, it's the biggest thing now is he built an addition onto his office for his daughter Alicia, who, like I said, is a chiropractic radiologist, but she's specializing in musculoskeletal ultrasound. So she's actually having an MD radiologist come in and work with her, where she would scan, tell the radiologist where to put the needle, whether it's pain medication, PRP, plasma-rich proteins, platelets for regenerative medicine. So, he's most proud of Alicia. She was a nurse first, then went to chiropractic school, and then became a chiropractic radiologist. So she knows her stuff, probably more so than Terry, but he won't admit
it. Everyone, Dr. Brownstein, first of all, thank you. Those books are, as far as books go, legendary in the chiropractic world. We all have them on our shelves. So thanks for what you do. Thanks for what you did to move, that forward in the chiropractic profession, and really appreciate that. And people can go to dynamicmedicalimaging.com. They can go to thespinalkinetics.com if they're interested. If anyone all over the country can send actually, distress radiographs so you can analyze them, because you've been doing this for 40 years. Check it out. Check out other episodes. Dr. Brownstein, thanks for having me.
My pleasure, Jeremy.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.